Welcome to In the Seams, a podcast by Broken and Mended with your host, David Heflin.
Hello, I'm glad to have you back on the Broken and Mended podcast, or as we call it here, the In the Seams. Broken and Mended is a ministry that hosts the podcast, and I am your personal host, David Heflin, founder and president of Broken and Mended. And I said, glad to have you back. Of course, some of you may be joining for the first time. If you're just finding us, we hope you'll stick around. Would really appreciate it if you would follow the podcast, review the podcast. This is something that we're trying. I'm trying to do. It's usually me. I often have a guest, probably at least half the time. I like to do it that way. I like to let you hear from other people. But today I'm just going to be flying solo. We're trying to do this a couple times a month when possible. Really, practically, it's worked out for me more about once a month. That's because I'm a busy person. I'm sure you are as well. Besides dealing with chronic illness and chronic pain, which I do, I am married. I have 3 kids. I am a minister, preacher of a church, and at the same time trying to guide this broken and mended ministry. And so sometimes I don't get as much done as I would like to get done. I'm sure many of you out there can relate to that. But I'm also learning that that's okay. You do what you can do, and we're not supposed to be thinking that it all depends on us anyway. And of course, people with chronic illness and chronic pain, that is a lesson that they learn in many different ways, and they have to. They have no choice because of the way that their health changes their situation. And actually, I'm going to be sharing on that theme today in a personal way, because that's what I'm going to be going through here for the next several weeks. I am to have my right hip replaced tomorrow. When you hear this, it will probably have already happened, but this is Wednesday, October the 12th, when I'm recording this. So on Thursday at 13th, I'm supposed to have right hip replacement surgery. So we'll be driving down there pretty soon, down to Norman from where I live up here in Northwest Oklahoma. So I'll be going down to Norman, Oklahoma to do that. And it's made me want to maybe share a couple thoughts. Maybe it's helpful for people that might be facing surgery themselves because of their chronic illness or have been through that in the past. I just was had the opportunity in a recent drive I had out of town to kind of reflect on some thoughts, that what it just it's just a strange thing to think about going in and having a joint replaced, and the fact that we can do that here in America. I kind of have this feeling, I don't want to say of guilt, but just knowing that other people in the world maybe don't have that kind of access to healthcare. You kind of feel like, well, why should I, have that kind of access? And that doesn't just apply to expensive surgeries, but to many other things, including the medicines that some of us take. The amount of money would cost for people to take my medicine if I had to pay out of pocket is absurd. And again, I know many of you are in the same situation. Maybe in other countries they could get that a little bit cheaper than we would get it here, because our own healthcare system raises the cost, of course. But I don't know. I don't know if it's even accessible to some of those people. And so I've just been thinking a lot about this issue. This isn't necessarily a podcast about pre-surgery, the eve of surgery nerves or anything like that. That's a relevant topic too. For sake of full disclosure, certainly I have nerves about what's about to happen, and I also am okay about it. It's I feel like some nerves are probably good, and nothing wrong with that. If I was terrified, I'd probably try to put off the surgery longer. And so it's kind of somewhere kind of in between terrified maybe and not having any feelings about it. But that's not the main thing I wanted to talk about today. I wanted to talk just a little bit about some reflections of what it means for us to have this kind of health care, and maybe to talk through just some of the implications of the privilege that many of us have, especially in the Western world. some of other places in the world too. I'm not saying Western world has all the answers to healthcare, and certainly has its struggles. But I do want to think about what this means from a theological perspective, what it means for my relationship with God. What should I be thinking spiritually, theologically on the eve of my surgery? That's kind of more where I wanted to focus the thoughts today. My experience with surgery, and I know a lot of people with chronic illness have had experiences with surgery, and some haven't, but probably will one day. It's certainly a more common occurrence with people with chronic illness than those who don't have chronic illness or chronic pain and injury or something that has to be repaired. In my case, it kind of started out that way because I injured my hips when I was in a taekwondo. This is in 2011, and at the time didn't know what was going on. And I'm not going to retell that story. I've told it elsewhere. But I ended up with an orthopedic surgeon in Albuquerque who was able to correctly diagnose what was going on, really on two levels. The first was, at that time, my primary interest was the injury to my hips. I couldn't do anything with them. I was having to give up taekwondo, and they were getting worse and worse, sharp pain and all that kind of stuff. So both hips. So it was a bilateral hip injuries, and didn't know what was behind it, but I was hoping that a surgeon could fix it because it wasn't ever getting better on its own. In fact, it was only getting worse. So he told me what was wrong. I had torn labrals. I had, what's called hip impingement and cam and pincer impingement. If you're familiar with that language, if you've been through that before, that's where you get bone growth, bone spurs. May be an okay word to use there, but you get it on the ball and the socket if you have cam and pincer hip impingement. And then because of that, and when you put stress on the hip or you rotate the hip, violently like you do in taekwondo and other things, because when you're kicking in order to get power, you're rotating your plant leg. You're rotating that out to get more power into your kick, and that's how I tore mine. And there was no flexibility there because of the extra bone growth. I didn't realize that. Obviously I wouldn't have done it, but in any case, it was a very painful condition. But as we're getting ready to do that surgery, he also tells me that, okay, it looks like you might have ankylosing spondylitis too. And that ended up being the underlying condition that has stayed with me even after I had the surgeries. And to be honest, the first thing I had to learn about surgery is it doesn't always fix what you want it to, or it takes a lot longer. And since I was not yet being treated for an underlying disease and the inflammation that comes with that, when they did surgery on my left hip, even though it was arthroscopic, it was quite invasive. It was 2.5 hour surgery, and they cleaned it up and put it back together. And I mean, it was extensive. With a lot of resurfacing of the bone and the joints, and when they did that, I had a very difficult time recovering from that. Insurance wouldn't pay for physical therapy, which was ridiculous, of course. But that was all out of pocket if I wanted to do it. So I didn't do very much of it. I did most of it at home. And because of the extra inflammation from my disease that was just really getting kicked off, it took me, I'd say 2.5 years before I felt like I had an improvement from the hip surgery than what I was feeling before I had the hip surgery. That's not what I expected. That was the first thing. And I guess, along with that, related to that, is underlying disease is something that's hard to predict, or if the situation could occur again, or if you fix one joint, is it going to affect another joint? And so there are a lot of other issues that kind of come up. What I had hoped for, because I didn't know about underlying disease, I didn't know about the inflammation and the ankylosing spondylitis. And so what I had hoped for when I went into surgery is that I would get it fixed, I would go through my rehab, and I would return to a normal life. And that never happened. That was crushing. So I should have had my right hip operated on much sooner than I did, but because I didn't get the results I wanted, I put that off from 2012 to 2016 when I finally had my right hip operated on. And that probably has the reason why my right hip is technically worse than my left now, and why it's going to be replaced before the left. I say technically because actually most of the time the left hurts me worse, so it's kind of strange. But from a radiographic standpoint, an X-ray, the right hip is worse. But anyway, it didn't fix everything that I had hoped. And so I think people with chronic illness and chronic pain have to have more realistic expectations. And so I've been more reluctant to explore surgery than I was before all this happened, Before, I don't those are the first surgeries I ever had were on my hips. But before, or at least before the first one, if a surgery would fix something, why not? You go through a little rehab, sure, but I was a little bit more hesitant, quite a bit more hesitant after that. In between that, I had to have hernia surgery, which obviously was not related to the other issues. But those are the three surgeries I'd had going into what's going to be happening tomorrow. Tomorrow, I'm getting my right hip replaced because the arthritis has continued there. The bone, the joint space, which was low even back in 2012, so 10 years ago, when they were first looking at my hips. They even though they fixed my hips from a standpoint of extra bone growth and did the labral repair, there's no way they could create extra joint space as I'm losing it. And so I had an arthritic hip, and I knew that I was eventually going to have hip replacement surgery. That's not a surprise. I had hoped to make it another 10 years, but the pain was too consistent and too limiting. The intensity of the pain is stronger sometimes than others, but it just became time to take action again. And I think it will, in this case, I think the risk of losing mobility and being inactive actually makes my health outcomes worse and more serious than if I get it fixed where I can still be somewhat active. And so that's the idea. Probably the left is to follow. I mean, that's the plan right now. We don't know exactly when we'll do that one. But that's what's upcoming. That's what I'm facing. And I know because of the ankylosing spondylitis that, first of all, the physical therapy is very important for me to rebuild strength in that hip. And then also that I got to keep an eye on the underlying inflammation, but at least I'm being treated for that, as I was not the very first hip surgery I ever had. As I said, as I was thinking about this, I was praying about it, to be honest. And as I was praying about it, I was thinking about the fact that I was evaluating my decision, I guess is the way that we might say it, because maybe I could put it off longer. And I started thinking about the places in the world where this wasn't even an option. And I started thinking about what that would mean for me. I have a disease that fuses joints. The disease is trying to fuse my hip joint. That's the problem. If I could not get this surgery and I could not treat the disease, both very expensive remedies, then my hip joints would have eventually fused. And actually, even with me treating the disease, they would eventually fuse and I would be crippled. I don't see how you can walk with a fused hip joint. Maybe you could shuffle. I don't even know, but the way I pictured it is probably a wheelchair. And so, it's a big deal that I can do this, whether I was to do it this year or at some point in the future. If I could never do it, that's what my fate would be. And so I understand that that is a big deal, but it got me to thinking about the fact that, that this is quite a privilege, quite something to be thankful for. And that kind of helped me to embrace the fact that I had made this decision, because I think that people in the world who would need this kind of surgery and can't get it, that they would think it foolish or even just very ungrateful not to pursue it when it's available for me, because they would want it if they could get it. It still made me feel just a little bit. I wish I could think of a better word than guilty. I'm not really. I don't really feel guilt about it or bad about it. I just have this feeling though, that it is quite a privilege to be able to receive this level of medical treatment and intervention. First of all, it's a privilege as it relates to history. This is not something that was available for all time. This has all been relatively recent, both in terms of the therapeutic drugs and the surgical interventions they can do to help someone with my disease. And so, living at a different time, would have been certainly would have again faced a prognosis of being crippled. But also, as it relates to where I live in the world, yes, health insurance situation here is a mess in our country. I know there have been political attempts to remedy it, which maybe has helped some. It has in my case. I know, and I'm not trying to be political. Some of you may not have been for the Affordable Health Care Act. You got your reasons. I got my reasons. But the bottom line is, it has allowed me to have affordable health care at a time when I really need that. And that has allowed me to have access to a pretty extensive medical intervention that would otherwise be, too expensive, to get done. And so I'm approaching this from a standpoint of I want to be thankful, but I don't want to take it for granted. Maybe that's the best way to say it. That I want to have a perspective that helps me to recognize that this is This is a blessing that a lot of people in the world just don't have. And some people might even hesitate to call it a blessing and may say, well, it's not like God's blessing you because, more than somewhere else. Well, that's somewhat true. I recognize the circumstances we are born into, not that God isn't sovereign over that, but there's what we might call fortune in it. There's some circumstantial things. Born in this country or born in some other country where this would be possible as well. I wanted to mention a book I read a few years back called Compassionate Jesus: Rethinking the Christian Approach to Modern Medicine. And this is written by Christopher Bogosh. If I wrote his name down right, it's Bogosh, if you want to check it out. For me, the theology in the book was a little bit different than my own. Not majorly. I mean, in terms of what you would consider Orthodox Christianity, it was the same, but some things that were different, and so not everything resonated with me in that book. Whether it would with you or not, I don't know. But the overall premise of it did resonate with me. And he was asking for us Christians that live in a situation where we do have access to all this medical care to try and form a much more Christian based theology when it comes to medical care, because he was in the medical field, and his observation had been that mostly Christians don't make their decisions any differently than anybody else that goes in for medical care. I mean, and we're not talking about, hey, I got strep throat, and because I'm a Christian I'm not going to take an antibiotic. Well, that's dumb. Don't do that. And there's a lot of bad theology where, I'm not going to get into the different churches who do this, who tell people not to use medicine at all. And that was not the extreme he was advocating for. As I said, he was in the medical industry. I think mainly what he was getting at in that book, and it's been several years since I read it, but I remember it enough to say that what he was getting at was that we should not look at the main goal of our lives as simply extending our physical lives, because we can't do that indefinitely. And as Christians, we're not supposed to be afraid of death. He obviously would say that we should get life saving care. And certainly the idea of what I'm looking at, like with a hip replacement surgery, care that would improve quality of life is good. And that's not something we should avoid. And it's not a lack of faith or anything like that to take advantage of those things. So yeah, that's a positive. And I just want to say that that was not what's being critiqued. He was looking more toward kind of what happens when we have the choice of trying to extend life versus choosing palliative care, or sometimes, what we call hospice care. So palliative care and hospice care, that sort of thing. And palliative care is, I think, a more general term than hospice, where we're just talking about making people's quality of life better, not necessarily trying to extend their life. These are very personal decisions. All he was saying is that we ought to go into those sort of decisions with a Christian mindset, with a theological mindset, and we ought to show our trust in God, and recognizing that we're not going to act like we're afraid to die when the time comes. That's a little bit beyond where I'm at in thinking about this surgery today, but it may not be beyond where some of my listeners are at, as they're having to make those kinds of decisions. And I know people have had to make those kinds of decisions. I know some Christians who have made the decision for palliative care, and they were very grateful they did that. They were grateful to focus on quality of life. I think when you're in a situation where you can extend your life and still be there for others, of course, that's a good thing to do. By the way, part of the reason I have this on my mind too is something else that had been in the news. This was out of Canada, and they have it's called MAID, MA, and then a lowercase I, capital D. It's a law there that it started out just allowing for euthanasia and kind of end of life situations, that is now being applied to people that have psychological disorders. I mean, in lots of different situations where people can choose to end their life legally through the help of a doctor. And now they're trying to make it where minors who want to do that, they call them mature minors, whatever that means, and that they would be able to do this and a parent couldn't stop them. I mean, it's from a Christian perspective, it's gone from at least something we might understand or sympathize with to something that is outlandish, and has no respect for the life that God has given us. And I know that as with people with chronic illness, chronic pain, we don't want to live in these bodies the way they are forever. There may be some sense in which death can be a relief. Death is never the ally, but it can be a relief from our suffering. And we believe in the resurrection, that God will give us new bodies, and that and we're going to live in perfectly sound and healthy, immortal bodies. And so, because of that, again, we don't hold on to life in a way that says that we don't believe that, but nor do we want to go to this other extreme that says that our life is just ours to end anytime we want to. And so that's another reason these issues are on my mind, and I think that we need to think through these things theologically. Look, God is the creator of life. Life belongs to him, including the life he has given me. And sure, I think endless suffering it's not endless. We need to remember that it isn't endless, because we're going to get to be free of it one day. But to just take our life in our own hands and to end it with our own decision, and I'm not just talking about suicide, which is somewhat of a different issue. Or okay, this is the same issue, but a different aspect of it. I'm just talking about someone who just decides they're tired of it all. They can't get the pain medicine they want, so they go kill themselves. Again, I certainly have empathy for a person in a situation like that. Uh, but we would fight to prevent that if we could, for the people that we love, and hopefully for ourselves. We would want people to help us prevent it if we were in that situation. And I see that law in Canada and and that's coming to some places here in America too, and just saying, that's the way we're going. We're going to where we are using the tools of the medical industry, which were meant to bless our quality of life, in some cases extend it, and instead using it to end life. And that to me is a great tragedy. Again, I know that may not be where a lot of my listeners are, but these are things that we need to think through. So, so that's how you could call it a soapbox, but I would hope that's one that we share. At the end of the day, sorry for the cliche there, but it's an effective one sometimes. I want to improve for myself what I can, my quality of life, because it makes me a little bit more of a easier person to be around in my family, a little bit more active. Hopefully, can improve my quality of life as well as the length of my life. If I can improve the quality of life where I can be more active, and I recognize that other people that can't have this life improving procedure, this surgery that I get to have, they would want to have it if they could. And so for me to think badly of that or to feel guilty about that, it really kind of misses the point. I'm thankful that I can do this. I'm a little bit nervous about it, but I am thankful. And I think when we can improve our quality of life, that we should. Now, granted, sometimes there's a financial aspect that comes into play. In this case, my out-of-pocket maximum was already met, makes it an easy decision from that standpoint. But I know these things can weigh in different ways than just what I'm talking about today. I'd like for us to commit to praying for and supporting efforts that are made to bring these miracles really to other people who otherwise would not have access to them. What we consider routine, they would consider miracles. I know there's been a lot of different efforts, medical missions over the years, and I kind of grew up in a tradition where we only saw that as a means to an end. Well, how many souls did you save? How many people became Christians? And if we couldn't give a real definitive answer about that, then it was like, well, that was kind of a waste of time. And I just think was just missing the boat so much, that when we have an opportunity to do good to others, as Scripture says, do good to others as you have opportunity to do good, that we ought to do it. And if we have a privilege like healthcare, and to have the ability to either prayerfully or through financial means, or if we're able to go, I know a lot of us aren't able to travel like that because of our chronic illness, but if we're able to, or even lend professional medical skills that we might have, or assist professionals in helping other people to go to other places in the world, I think it is an awesome blessing. And I know God will be glorified, and people will be brought to Christ, whether we know about it or not. And these things are something that we need to support in every way that we can, because there are a lot of people out there suffering to a greater degree than some of us are. And some of us are suffering pretty badly. And yet we still have some relief from medicines, interventions, therapeutic medicines, and so forth. And we need to recognize that, and to recognize there's people out there that are beyond miserable, that don't have access to these things that we can help with. Maybe you have heard about mercy ships. Mercy ships, apparently, as best I understand it, I've read about it. I haven't. I think there's a series that you can watch about it. But these ships, gigantic ships that go to different countries, different ports around the world, with doctors and nurses and other volunteers and medical equipment and supplies, and just do things that are just unbelievable. I think one story I heard was someone who was given sight, through an ophthalmologist, a surgeon, and because that person was able to give them something, give them opportunity for something that again to us would be routine, and yet for them it was anything but routine, and they were able to see because of that effort. Obviously, you can't fix everything. Well, we can't fix everything here in America or other places in the Western world or other modern places. It's quite clear that people are still going to suffer. People are ultimately still going to die. So we understand this, but there is a lot that can be done, and there are tons of preventable diseases and tons of different interventions that could help people who are suffering greatly in the world. So I'll end by just saying, let's be thankful for what we have access to, but let's not have the mentality of hoarding it to ourselves if we can do anything to speed that along to people who have that need. And I think that that's the Christian perspective that we want to have. Well, when you're hearing this, as I said, my surgery's likely over. I appreciate your prayers for my recovery. Perhaps on the next podcast, I'll be able to update on that, how that's going. And likely we'll have the left hip done in anywhere from weeks to months. We'll see how that works out. But thank you for listening to In the Seams. Always glad to just share with you, and hope that some of the thoughts and reflections that I had today can be of help or be a blessing to you as you think through some of these things for yourself. And we'll add, please check us out at brokenandmended.org. There you can hear the podcast. There you can see our blog post, and you can also connect with either our support groups or our social media presence. All that stuff is linkable through the website at brokenandmended.org. And if you reach out through the contact form, if you need special prayers or you need anything, or you got an idea, maybe something we could offer or talk about, be glad to take that under consideration. So I'll sign off for now and hope that you have a blessed day or night, whenever it is you happen to be listening to this. And I will talk to you next time.